There are people who haven't missed a dental cleaning in 20 years. They go every 6 months, without exception, and yet they still develop cavities. They still develop gum disease. Some of them still develop chronic inflammation that quietly affects other parts of their body. So maybe prevention is not what we think it is. Welcome to the Dental Longevity Show. I'm Dr. Mario Parra, and this is episode 10, the last episode of our Foundations block. Today, I want to challenge one of the most deeply held beliefs in oral health, that going to the dentist regularly is the same as doing prevention. It's not. And understanding why could change the way you take care of your mouth for the rest of your life. Let's start with something almost everyone assumes, the 6-month rule. You go to the dentist twice a year, you get a cleaning, you get a checkup. You're told everything looks fine, or you're told you need a filling. Either way, you leave thinking you just did prevention. But where does that rule come from? And what does the evidence actually say? A scoping review published in 2023 by Amarasena, Lutzi, and Brennan looked at the effect of different frequencies of dental visits on caries and periodontal disease. What they found is worth paying attention to. For adults, there was little to no difference between 6-month, annual, or risk-based recall intervals in terms of dental caries and periodontal outcomes. The evidence did not support a universal fixed frequency. Now, let me be very clear. I'm not saying you should stop going to the dentist. Professional care matters. What I am saying is this: the problem is not going every 6 months. The problem is believing that frequency alone equals prevention. Because between those two visits, there are roughly 180 days. And what happens in those days, what you eat, how you breathe, how you sleep, how you manage stress, how you care for your oral environment, that is where prevention actually lives. So, if prevention is not a cleaning, what is it? One of the best-known examples of this shift comes from the CAMBRA framework, Caries Management by Risk Assessment. A review by Featherstone and Chaffee, published in 2018, summarized over 14 years of clinical application at the University of California, San Francisco. The idea behind CAMBRA is straightforward but radically different from traditional dentistry. Instead of waiting for damage and then repairing it, you assess the individual's risk factors, identify what's driving disease, and intervene before cavities form. In a randomized controlled trial with 460 patients, the group that received CAMBRA-based interventions, antibacterial therapy, fluoride protocols, risk-targeted strategies, showed a significantly lower increase in new caries compared to the control group, which received conventional care, 24% lower, and the control group, which only received restorations, did not see their risk level reduced at all. That last point is critical. If the environment doesn't change, the disease process usually returns. You can fill a cavity, but if the conditions that created it are still there, the biofilm, the pH imbalance, the dietary pattern, the dry mouth, another cavity is likely on its way. Prevention is not an event. It's a strategy, a continuous one. So if the science already points in this direction, why hasn't the model changed? That's a fair question. And the answer is not about bad intentions. A qualitative study published in 2021 by Leggett and colleagues, part of the Advocate project funded by the European Union, explored this across 6 countries. They interviewed dental teams, policymakers, insurers, and patients. And what they found was revealing. Dental care systems across Europe remain largely treatment-oriented rather than prevention-oriented. And one of the most consistent patterns was that each group tended to shift responsibility to the others. Bourgeois, in a 2023 review, put it even more directly. Evidence-based, cost-effective preventive strategies already exist, but they are not being implemented at the scale they should be. dentistry became very good at repairing damage, much slower at preventing the conditions that created it. This is not a criticism, it's a recognition, and recognizing it is the first step toward changing it, both for the profession and for you. So, what does real prevention look like? I'm not going to give you a full protocol today. That's a conversation for a future episode. But I want you to leave with a clear framework. Real prevention is daily. It's not something that happens to you twice a year in a dental chair. It's what you do every morning, every evening, and in between. Real prevention is personalized. Your risk is not the same as someone else's. Your microbiome, your saliva, your diet, your breathing pattern, your stress levels, your medications, all of these shape your oral environment in unique ways. Real prevention is active. It's not delegating your health to a professional and hoping for the best. It's understanding your own mouth well enough to make informed decisions and working with a professional who helps you do that. And real prevention is connected because, as we've seen throughout this entire block, the mouth doesn't exist in isolation. Think about what we've covered. Your mouth is not separate from your body. It's part of the same biological system. Your gums can signal inflammation before you feel anything. Your saliva protects, mineralizes, and regulates. Your oral microbiome is a living ecosystem that responds to everything you do. Inflammation can build quietly over years, and bacteria from your mouth can enter the bloodstream. All of that is happening right now, every day, between visits. And prevention is how you manage it. Not once, not twice a year, continuously. This is the end of our foundations block. In the next block, we'll go deeper into the connections between oral health and the rest of the body. The gut, breathing, sleep, hormones, diabetes. The research that is starting to connect what happens in your mouth with what happens everywhere else. But none of that matters if you don't understand this first. Prevention is not something that happens to you twice a year. It's the environment you create every single day. Pay attention. Your body already is. See you in the next episode.